Hello, this is your discussion on arterial disorders. Now let's differentiate the terms arteriosclerosis and atherosclerosis. So when we say arteriosclerosis, there is hardening of the arteries. So the key word there is hardening. And then when we say atherosclerosis, your atherosclerosis involves accumulation of lipids, calcium, blood components, carbohydrate, and fibrous tissues. And this accumulation is referred to as your atheroma or plaques. Now, your atherosclerosis is the one that we've discussed under your coronary artery disease. However, oftentimes these two conditions occur with one another. Pathophysiology. Our main problem in atherosclerosis is the narrowing or stenosis of the lumen, and then the obstruction which can be brought about by the thrombosis which get clogged in the deposits or the plaques, and then aneurysm, ulceration, and possibly rupture. Indirect results are including malnutrition and fibrosis of your organs. So how come it leads to the fibrosis of the organs? This is related to the lack of oxygen supply, lack of blood and oxygen supply to the organs supplied by the atherosclerotic artery. There are two types of atherosclerotic lesions, and then you have your fatty streaks and then your fibrous plaques. So when I say fatty streaks, these are usually yellow and smooth type. They protrude slightly into the lumen of the artery and composed of lipids and elongated smooth muscles, whereas your fibrous plaques are composed of smooth muscle cells, collagen fibers, your plasma components, and lipids. Let's talk about collateral circulation. One of the major problems that we have again in atherosclerosis is the narrowing of your arterial lumen. Now, because of the narrowing of this arterial lumen, the collateral circulation development is being triggered. So when we say collateral circulation, this is circulation that arises from pre-existing vessels that enlarge to reroute the blood flow around a hemodynamically significant stenosis or occlusion. So assuming that this will be your blood vessel, and then there will be an occlusion because of your atherosclerosis on this part, okay? The tendency is for the collateral circulation to take place on this part. So there may be smaller blood vessels here, and the tendency of these smaller blood vessels is to enlarge to adapt with the increasing volume that is passing through this side to oxygenate the peripheral aspect. So we refer to that one as collateral circulation. The collateral flow allows for continued perfusion of the tissues. However, because of the size of the arteries there or the alternative routes, it tends to be often inadequate to meet the increased metabolic demand. Hence, ischemia still results despite the collateral circulation. Modifiable risk factors. We talk about nicotine. So you know that your nicotine causes vasoconstriction, stimulates your sympathetic nervous system, and which leads to decrease of blood flow to the extremities. Okay? So again, when we say vasoconstriction, we know that there is increase of blood pressure. However, on the vasoconstricted areas, take note that the blood flow is decreased. Heart rate, blood pressure is increased. Clot formation risk is also increased. It also leads to vasospasm, okay, which leads to decrease of oxygen transport, and increase in blood viscosity. All of these factors combined make it difficult for your blood to circulate. Then you have your diet. So especially diet contributing to hyperlipidemia, hypertension, especially if poorly controlled, it is a major risk factor in coronary artery disease. Your diabetes also speeds up the atherosclerotic process by thickening the basement membranes of both the large and the small vessels. Then your hyperlipidemia, okay, just the same way as your diet. Stress, especially personality A, personality D, and then your sedentary lifestyle without activity. Elevated C-reactive protein, which is a marker for inflammation, both systemic and local. So a slight increase in your CRP are associated with an increased risk of damage in the vasculature. We also have the condition hyperhomocystinemia. Here the problem is homocysteine, which is a protein that promotes coagulation by factor 5 and factor 11. While it depresses the protein activation and increasing the binding of lipoproteins and fibrin. So, the increase of your homocysteine increases the clotting and at the same time increases the deposit of your lipids. So that's why the condition is referred to as hyperhomocystinemia. Then you have the non-modifiable factors, age, female gender, and then familial predisposition or genetics. So to prevent the occurrence of this problem, you need to control the serum cholesterol. Then you have to control the blood pressure and then eliminate controllable risk factors. Medical management for this condition would involve modification of the risk factors. We've discussed the modifiable ones. Exercise program, which would improve the circulation and functioning capacity. Then, administration of your anti-hyperlipidemic agents, which are your statins, atorvastatin, simvastatin, interventional or surgical graft procedures. Now for the surgical management, there are two groups which are commonly done. One is your inflow procedures. Your inflow procedures would involve your angioplasty, then your stent placement, and then your CABG, coronary artery bypass graft. Commonly done if you're talking about cardiac blockade. Now, outflow procedures. Outflow procedures provide blood supply to the vessels below the femoral artery. That's why it's referred to as outflow procedures, because it's going out from the heart. Outflow procedures. Examples of radiologic procedures that can be done for your atherosclerosis are PTCA, or your percutaneous transluminal coronary angioplasty, or simply angioplasty or atherectomy. So what happens in your PTA is that a balloon is inserted through the injured blood vessel or damaged atherosclerotic blood vessel, and then a balloon will be used to inflate and to increase the diameter of the lumen of your arteries. In atherectomy, there is removal of the atherosclerotic plaque. Then complications possible after the surgery, there might be hematoma formation, okay, embolus, and then dissection of the vessel, acute arterial occlusion, and then bleeding. For this reason, depending on the bleeding parameters of the patient, antiplatelet medications may be prescribed to address the risk for emboli formation. However, if the bleeding parameters are abnormal, okay, these medications will be placed on hold. Nursing management would include improving peripheral circulation. So that would depend if the problem is arterial or venous. If we are looking into an arterial problem, the advice is to lower the extremities below the level of the heart. That would allow adequate perfusion going towards your periphery. Now, if it is venous in origin, meaning our problem is that there is a limitation or there is an impediment on the blood that goes back to your heart. So if the problem is venous in origin, you need to elevate the extremities in such a way that it will improve venous return going towards your heart. Okay, walking is encouraged or graded extremity if no contraindications exist. We discourage standing still or sitting for prolonged period of time because that causes venous pooling. Increases the risk also for thrombosis. Graded isometric exercises may be prescribed also, and the purpose of which is to promote blood flow and encourage the development of collateral circulation. So that is with the hope that your collateral circulation will be able to augment with the decrease in peripheral blood flow. And the next group of interventions are inclined on promoting vasodilation and preventing vascular compression. So if we want to promote vasodilation, warm temperature is recommended. We avoid chilling to promote arterial flow. Then, of course, no tobacco products. Okay, emotional upsets should be addressed because your stress causes peripheral vasoconstriction with your SNS stimulation. Constrictive clothing is not encouraged because it also impedes your circulation and promotes venous stasis. Then leg crossing, also the same. It promotes your venous compression and venous stasis. Then we administer vasodilators and adrenergic blockers. So again, the purpose of vasodilator is to improve the blood flow. On the other hand, your adrenergic blockers will halt the functioning of your sympathetic nervous system. Okay, remember, sympathetic nervous system would cause vasoconstriction. Hence, you are giving your adrenergic blockers, such as your beta blockers, your calcium channel blockers, to cut off the functioning of your sympathetic nervous system, hence leading towards vasodilation still. Then relieving pain. To relieve pain, that would be congruent to increasing the circulation going towards the affected artery. Then we administer analgesics. The purpose of analgesics is to reduce pain and allow client to participate in activities, because your client will not be participating in activities if there is pain experience. Let's go to the next disorder. We have your Raynaud phenomenon. So your Raynaud phenomenon could either be Raynaud's disease or it could be Raynaud syndrome. Now, when I talk about Raynaud phenomenon, it is a form of intermittent vasoconstriction. It results in the coldness, pale pallor of fingertips or toes. So remember, our common problem here would revolve around your fingertips and toes. So it more commonly occurs among women, okay, compared to men, and the onset is commonly before the age of 30. There are two forms. So when we talk about Raynaud's disease, this is a comparison of your Raynaud's disease and Raynaud's phenomenon. Just think that we're talking about Raynaud's disease, okay, it's primary, meaning there is no underlying disease processes other than Raynaud's, and then it's idiopathic, so meaning the cause could not be known. Then secondary, this is secondary to diseases such as your systemic lupus erythematosus, rheumatoid arthritis, scleroderma, and obstructive arterial lesions. So take note that these disorders commonly lead to your Raynaud's phenomenon, referred to as Raynaud's syndrome. Clinical manifestations among these patients would include the characteristic sequence of color change described as white, blue, and red. So usually it would progress from pallor, then become bluish, and then rubor, which is a red color. Then other manifestations would include numbness and tingling, okay, burning pain with the color changes, and then you will have bilateral and symmetric involvement of your toes and fingers. Again, the emphasis is on the involvement of toes and fingers. Then you have acrocyanosis. Okay, there is a clamminess, meaning the patient's skin is clammy, and then there is hyperhidrosis. So when we say hyperhidrosis, there is excessive sweating. The finger color normalizes when the hands are transferred from dependent to horizontal position. So again, if it is transferred from dependent to horizontal position, it tends to normalize, meaning if the hand is placed at the level of the heart. Then we have the diagnostic study. Your angiogram is intended to confirm the diagnosis because your angiogram could detect vasoconstriction. Then, conservative treatment are as follows. So, avoid the stimuli that triggers your Raynaud's. Clients must keep hands warm by wearing gloves because the cold will trigger your Raynaud's. Then smoking cessation, we know that smoking leads to vasoconstriction. And then stress relief methodologies, and then lifestyle changes. For our medications, since we are talking about vasoconstriction, vasospasm, our choice will be your calcium channel blockers. So with that, you should remember nifedipine, nimodipine, drugs that ends with dipine, plus verapamil, and diltiazem. Then, if the patient is not responding to the medications, you need to do your lumbar sympathectomy. So when we say lumbar sympathectomy, what happens is that there will be an injection of a drug, okay, or an anesthetic agent through the lumbar region, specifically on the sympathetic nerves. And the purpose of this is to prevent the innervation of the sympathetic nerves to the periphery. Because if the sympathetic nervous system will be able to innervate the lower extremity, it would more likely to cause pain, okay, or your Raynaud's phenomenon also. Then you have your thromboangiitis obliterans. So your thromboangiitis obliterans is also known as Buerger's disease. So when we say Buerger's disease, it is an occlusive vascular disease in which small and mid-sized peripheral arteries become inflamed and spastic, causing clots to form. Take note that we are talking about mid-sized peripheral arteries. Contrast that with your Raynaud's. Your Raynaud's affects the arterioles. So when we say arterioles, it is more likely to the peripheral aspect. That's why the effect is limited on the toes and fingers. Whereas if I will be talking about thromboangiitis obliterans, so the effect is on the peripheral arteries, small and mid-sized peripheral arteries, meaning it can affect the entire arm or the entire leg of your patient. The very big cause here is smoking and nicotine still. So pathophysiology, the inflammatory cells tend to infiltrate the wall of small and mid-sized arteries, okay, in the feet and possibly the hands. Because of that infiltration of your inflammatory cells, thrombus formation and vasospasms would occur. Okay, thrombus formation, you know that if there's a clot, there will be a block to our blood vessel. If we talk about vasospasm, vasospasm talks about constriction. Once there is constriction, blood flow is impaired towards the affected part. Then, if the disease would progress, there will be scarring and fibrotic vessels. Okay, scarring and fibrotic vessels would occur. Now, common assessment. Primary manifestation among these patients is pain. They will have your intermittent claudication, which is the cramping pain in your calves and feet or the forearms and hands, and rest pain in the fingers and toes may occur. The pain on exertion is induced by exercise. Then there seems to be a diminished sensation on the affected part because of decreased peripheral blood flow. the skin becomes thin and shiny, and the nails are thickened and malformed. So the thin and shiny skin there is brought about by quote-unquote malnutrition or decreased nutrition going towards the peripheral aspect of the body. Okay, and then the nails are thickened and malformed because also of the lack of protein that goes towards the peripheral aspect of the body. The digits or extremities tends to be pale, cyanotic or ruddy, and cool or cold to touch. Again, decreased perfusion. Distal pulses are even difficult to locate or sometimes absent even with a Doppler device. So again, reason, peripheral tissue perfusion is impaired. Now, if it will be for severely impaired blood flow, it can result to painful ulcers or gangrenes. Okay, painful ulcers or gangrenes may occur. Laboratory and diagnostic tests. Now you have Doppler studies, you have angiography, and then you have magnetic resonance imaging. Okay, so these studies are intended to have a detailed view of the blood vessels in such a way that it will be identified if where is the constriction and where is the thrombus formation. For more details about these diagnostic studies, refer back to the video on assessment. Then conservative management should insist client to stop smoking. Okay, should be a strict stop smoking cessation or smoking cessation. Keep extremities warm, remember, cold triggers. Manage stress also. Then keep extremities in dependent position because our problem is arteries. And then you can do your Buerger-Allen exercise. So for your Buerger-Allen exercise, what's happening here is that you elevate the leg and then you lower it down. Okay, and then you put it at rest. Okay, so the purpose is it is intended to improve the circulation to the feet and the legs. So you elevate it at 45 to 90 degrees first. That would last for 2 to 3 minutes. And then later on, it would lower down. You would lower down the leg versus the rest of the body until the redness would occur. So that would take about 5 to 10 minutes. And then you would place the legs flat on bed for a few minutes. Okay, that would take about 10 minutes. So although that would depend on the color changes and then the patient's tolerance, but the main purpose of this exercise is to improve the circulation to your feet and legs. This is an illustration of your Buerger-Allen exercise. So one there shows elevation of the leg, and then the second one is the lowering down of your leg versus the body, and then third one, the leg flat on bed. Again, with the main purpose to improve circulation to your feet and legs. Medications. No specific medications, but still your calcium channel blockers to induce vasodilation, prevent vasospasm. And then your pentoxifylline or oxpentyphylline is also given. Okay, so they decrease blood viscosity and increase red blood cell flexibility to improve peripheral blood flow. That's the main function of your oxpentyphylline or pentoxifylline. The purpose is to decrease the blood viscosity. Because if your blood is viscous, meaning your blood is thicker, the tendency of your blood is to become static. Okay, stasis is more likely to occur. Now, let's go to surgery. When I talk about surgery, so you have your sympathectomy. Sympathectomy interrupts the sympathetic nervous system, okay, input to the affected vessels, reducing vasoconstriction and spasm. So the same, you can have your lumbar sympathectomy as discussed under your Raynaud's phenomenon. Then you have your arterial bypass graft, which may be useful when larger vessels are already affected by the disease. Okay, you need a graft. And then if you are dealing with gangrenes already, which is a result of a prolonged lack of perfusion towards the affected part, you might need to have your amputation already. That is to prevent ascending necrosis. Then, nursing care, okay, geared towards promoting arterial circulation and preventing prolonged tissue hypoxia. So the same, no constrictive clothing, adequate oxygenation, okay, exercises. Then smoking cessation is strongly recommended. Thank you very much for your kind attention.